Danny is about to shoot up heroin, not in a clandestine setting, but in a private facility in Harlem, New York.
It's a safe place to be.
For his privacy, we are not showing his face. This is an overdose prevention center, one of only 2 in the nation.
They will keep you from having an overdose. They have the medication that they put into you to clear out your system to stop the overdose.
The 2 centers, one in Harlem and the other one in New York's Washington Heights neighborhood, are run by the nonprofit OnPoint NYC.
For me, it was a response to losing too many people to overdoses.
The facility's director, Sam Rivera, says the primary purpose is to stop overdose deaths. It's not about rehab or to stop people from using.
The goal is to keep them alive.
They also create a welcoming environment for their participants. That's what they call the visitors looking for a safe place to use drugs.
It's an opportunity for us to give them a space that's respectful, that's supportive, that treats them with love and really humanizes their process.
This facility opened last year, a reaction to the record number of drug overdose fatalities in the city during the pandemic.
This is really a response to a very scary time we're in.
As the pandemic lingered, the New York City Department of Health recorded 30 drug overdose deaths for every 100,000 residents just in 2020. That's triple the amount from 20 years ago.
We have a partnership with the Parks Department in New York City. They average 13,000 syringes a month. They're collecting from the park. Since we've opened, that 13,000 went down to 1,000.
So we have people sniffing, injecting, smoking, and a combination of the 3.
Ray Samuelson is in charge of the closed-off area, a room with booths and staff with medical background. This is where people can use drugs, such as heroin or cocaine. Visitors bring their own drugs, but the staff provides them with clean syringes and other supplies.
We have a variety of different size needles, tourniquets, Band-Aids, gauze, alcohol pads, everything needed to use safely.
How are you able to monitor all of them at once if they're all filled out and somebody is at risk of an overdose?
Yeah, I mean, that comes to our staffing. We have a strict ratio between how many participants we can have in the room and staff, so that's a 4-to-1 ratio.
Since opening last November, there have been over 1,000 participants. Staff at the centers had reversed at least 270 overdoses.
We have this Narcan if we need it, and if we see someone go down quick.
The new centers have faced a backlash from local groups and politicians. Those against the program believe it encourages and enables people who have addictions instead of doing something to actually help them. Republican Congresswoman Nicole Malliotakis, who represents parts of South Brooklyn and Staten Island, introduced a bill that would prohibit overdose prevention centers from receiving any federal funding. We reached out to her office for an interview, but she was not available. For its part, OnPoint runs its 2 centers on funds from private donors.
So that's the alternative, right? People say to me what you just said. Oh, let's go outside and tell people, hey, you want to stop? Let me send you to this place. They've all been there. It doesn't mean they can't go back and get it. But in the interim, while they're still using, we're going to keep them alive. And that's a responsibility of the community as well.
For Danny, it hasn't been easy to stop using.
For how long have you been using?
38 years.
Have you ever thought about quitting?
I have, and I did quit everything for 3 straight years. But God knows why I started again.
At the centers, the participants can also receive medical and holistic services at no charge. And many of the people on staff were once users.
I came here as a participant myself last year, and I'm in recovery over a year. After a while of volunteering here and everything, they offered me a job, and it just was a great opportunity.
As for OnPoint, Executive Director Sam Rivera says he plans to open more facilities and help other organizations around the country open their doors with a goal of saving lives. Axel Terzius, Newsy, New York City.